So, distinguished guests, respected healthcare leaders, and nurses and midwives, ladies and gentlemen, good morning.
Good morning.
It is a privilege and an honor to stand before you today to speak on the theme that is deeply important to our profession and to the future of healthcare in Ghana. Our nurses are future. Empowered nurses save lives. This theme is more than just a slogan. It is a powerful statement about the value of nurses and midwives in society. It is also a reminder that the future of healthcare depends greatly on how well we empower those who stand at the forefront of patient care in every single day. Nurses and midwives are the heartbeat of the healthcare system globally. In every hospital, clinic, health center, and the community, nurses are often the first people patients meet and the last people they see before they are discharged. When a mother is in labor at midnight, it is usually a midwife who comforts her and safely guides her through the childbirth. When an accident victim arrives at the emergency ward, nurses are among the first responders. During disease outbreak, nurses continue to work even when others are afraid. During the COVID-19 pandemic, many nurses across Ghana worked for long hours under difficult conditions. Some stayed away from their families to protect them from the infection. Some cared for critically ill patients despite the fear and the uncertainty. Their dedication reminded the world that nurses are not only caregivers, they are heroes and leaders. Ladies and gentlemen, healthcare systems cannot function without nurses globally. Yet many nurses continue to face enormous challenges all over the world. Some work in conditions that are overcrowded wards with inadequate equipment. Others experience emotional exhaustions due to staff shortage and heavy workloads. Many nurses feel undervalued despite their sacrifice. But today, I want to remind every nurse and midwife here that your contributions matters, your voice matters, your leadership matters. An empowered nurse is not simply someone with a title. An empowered nurse is someone who believes in their ability to make a difference. And empowerment comes through education, confidence, mentorship, courage, and continuous professional development. Leadership is not reserved for people sitting in offices. Leadership begins where there is influence. A nurse who identifies a medication error and prevents harm to a patient is demonstrating leadership. A midwife who educates young mothers about safe childcare practices is demonstrating leadership. A nurse manager who encourages teamwork and supports union staff is demonstrating leadership. Leadership is about taking initiative, solving problems, and inspiring others to do better. Let me share this example. Imagine a district hospital experiences sudden shortage of oxygen during an emergency situation. A passive worker might wait for instructions, but a strong nurse leader immediately coordinates instructions. Strong nurse leader immediately coordinates communication between departments, reassures patients and families, organizes available resources, and collaborates with doctors and administrators to manage the crisis. This is leadership in action. Let us clap for nurses all over the world. Another example can be found in our rural communities. Many community health nurses travel long distance to educate families about immunization, maternal health, sanitation, disease prevention. Their work prevents illness and saves lives before patients even arrive at the hospital. Let's give it to community health nurses. That too is what? Leadership. Tell somebody that too is leadership. My dear nurses and midwives, the future of healthcare in Ghana depends heavily on nursing leadership. We need nurses who are innovative. Nurses who can come out of the blue to craft solutions. Solutions that go beyond the bedside, go beyond the classroom, go beyond our traditional, conventional thinking. We need nurses that are compassionate. All over the world, in Ghana, Ghanaians are crying, not just for professional, but they are crying for compassionate nurses who will be able to identify the causes of the pain they go through without verbalizing them. They are crying for nurses who will be able to make decisions that are research-based, decisions not based on emotion, evidence-based, data-driven, so that any decision that the nurse is making is backed by research. The world is looking for nurses that are digitally competent. In today's world, the world has moved on, and if you hate ICT, technology, you will be left behind. So the world is crying for nurses that will be adapted to technology, ability to use technology to transform the healthcare industry, ability to use technology to communicate, improve upon the care of our clients. We are looking at ethical nurses all over the world. Nurses that will be, thank you, nurses that will be able to stand by the principles that they were taught. When you read the pledge over here, a lot of things, if you reflected upon it, it sends shiver to the spine. Today, where are the ethical nurses all over the world? People are bending the rule, people are breaking the back of clients, others are taking money from them, others are doing things that are non-professional. So the world is calling for sadness. Then strategic thinkers, nurses that will be able to think strategically. Strategic thinkers are those who don't even think outside the box. They push the box away. There is no box even in their area of thinking. The world is calling for nurses, and you are the answer. The healthcare environment is changing rapidly. Technology is transforming patients' care. Diseases are becoming more complex. Patients are becoming more informed. Healthcare systems are under increasing pressure. Healthcare systems are under increasing pressure. When senior nurses share knowledge, support care growth, and create opportunity for younger professionals, the entire healthcare system becomes stronger. So the world is calling for nurses that will support one another. We must also talk about professionalism and integrity. An empowered nurse must demonstrate discipline. Discipline to your own profession. Even when you don't have money, there is no law that permits you to squeeze the hands of clients. Even when you are under pressure, you still stand your integrity. And that is what the world is looking for. All over my years, I have rather given to patients. No patients one city has entered into my pocket. And I stand here to say that with all dignity. And these are the things that makes us nurses. And we are talking about respect. Respect for our clients, addressing them by their names. So you see 80-year-old man at the OPD. It's called Kwame Mensah. This man is a chief in his hometown. And 80 years, the numbers will tell you this man is not a juvenile. And you mention the name Kwame Mensah. This man is a chief in the community. How will you feel if this man is your dad or is the chief? These are the things that nurses must pay attention to. Accountability. We must be accountable to each other. We must not run the hospitals like our own provision store. There are policies, there are norms, there are governance structures that underpins what we do. Then compassionate. Patients trust nurses because they believe nurses genuinely care about their well-being. The trust must never be taken for granted. For somebody to come onto the theater table and this person doesn't know the outcome of the surgery. I think recently I was going to, clean my teeth. And when I was lying on the theater bed, no invasive procedure, I was asking, what am I going to do? Is it painful? Nothing. Can you imagine people trusting you with their entire life on the theater bed, and you know they do it at will? Let's clap for ourselves because we're very special. So professionalism is not only about wearing uniform, it is about how we communicate, how we treat patients, how we handle pressure, how we represent our profession every day. Dignity, respect is very key. And we need to give respect to those for whom respect is deep. And that is a sign of our professionalism. So that junior nurses will not for any reason insult senior nurses. We go to the military. Anytime, yes sir, master, you will salute until the kingdom come. And you see, if you don't identify your superior, you are in trouble. So all the time, permission to carry on, permission to carry on. Before you move, at any given time, you need to recognize that. When we are able to recognize our superior, then they can also share with us the wisdom and the knowledge they have acquired over the years. Another important area is mental health and well-being. Many nurses carry emotional burdens silently. The stress of long hours, patient death, family expectation, financial pressure can affect mental health. Healthcare institutions must prioritize staff welfare, but nurses must also learn to support one another. We must create a workplace where people feel respected, valued. Out of 500 plus people that were nominated in the country, I was part of the 10 people selected by Joy News as making impact in Ghana. When nurses rise and make impact, things get better. Last year we were in 10 communities, writing proposal, winning project to help communities. These are the stories that must what? Inspire the profession. And I believe that you have the capacity to be able to do that. The future of healthcare will depend greatly on you. Nurses are given opportunity to lead, innovate, and influence decision making. As I conclude, ladies and gentlemen, I want to challenge every nurse and midwife listening to me. Lead where you are. You don't need promotion to provide leadership. In the Sunyani Teaching Hospital, I don't have any position that I've been appointed with a letter, but I have trained everybody over the years in the Sunyani Teaching Hospital. And the reason why I lead the Quality Assurance Committee, I'm on the Regional AIDS Committee with the Regional Minister. We are a 9-member committee. 2025, during the constitutional review, I was part of those invited to come and make input. I don't need position to make an impact. I support leaders all over the places. So nurses and midwives, you don't need to be the CNMO before you make impact in Achimota Hospital. If you have the solution, if you have something, bring it onto the table. And I believe that is actually where we should be looking for, instead of fighting one another. And I have never fought for any position. I have never fought for any position. I lead a lot of people. I lead doctors. I lead lawyers. I lead bankers, engineers on board meeting. Simply because I saw I need to build capacity for myself. That is the new nurses that we are calling for. Not people who will say they didn't do this for us. And I believe that if we are able to do that and lead through excellence, through compassion, for professionalism, teamwork, you can't do it alone. Why will I be in Sunyani and be here? I do training for all the facilities in the Greater Accra region. I go to a lot of places within public and then the private sector. You cannot do it alone. Tell somebody, learn to collaborate. Or tell the person, learn to collaborate. Even in the same hospital, we may be around, but we are not collaborating. We are not sharing our synergies and our energies. And at the end of the day, patients will suffer. I'm concluding. So let me conclude this in a better way. This is the first time I've read a speech like this. At the end of the day, we are the future of our country. If nurses provide leadership, I think that the problem of medical doctors, Dr. Jacqueline, will be less because you form majority of the health workforce. It cannot be done without you. But nurses must be committed to personal, professional development. Hello? Hi. Personal health, professional development. The more developed we are, the more enhanced our decision becomes. The more less we are able to solve our problems. And that is what I want to leave with you. Don't leave your development to chances. Don't leave it in the hands of your employer. Don't leave it in the hands of the government. For me, in my hospital, they have not paid any money on my training. I have paid for all my trainings. 2016, when I was doing my OD program, it is not nursing oriented. Why will I be encouraged to go and do a program like that? I came back, I rather train everybody in the facility. And at the end of the day, I paid about 16,000. 2016. 2 years ago, I paid over 15,000 for my chartered management consultancy program. I paid for everything that I do. But I realized that one of the things we are not capable of doing is we are not willing to commit ourselves to our development. So one day as a consultant, maybe I can be paid your monthly salary in a day. Because by the grace of God, I can stand and do in an hour what somebody will do in 10 hours. Simply because I have committed myself. I'm living on this note and I want to leave this with you. That don't blame your CNMO, don't blame your medical director or your administrator. If they do it, that is fine. But even if they don't, tell yourself that me, I am going to build my own hall. capacity. I bought my projectors. I bring my projectors to the hospital, be training people. And in fact, those were the time God was training me up. And at the end of the day, I do training for people outside Ghana. I do coaching for top leadership. Why? Simply because I didn't wait for anybody. So nurses, as we are celebrating you today, that is the greatest celebration ever. I stand in places. I was at Accra International Conference Center with all people, live on Joy News, giving a speech. How could I have spoken? But because I don't just speak nurse, a lot of people, they don't even know I practice as a nurse. But I'm also well. I do it and do it very well. So when I'm living with you, Achimota, Greater Accra is the heart of Ghana. Right? In fact, Greater Accra is the heart of Ghana. You are closer to the heart to receive vascularization. But we are far away. Hello? No, you are closer. You are within Ghana. When we say Ghana, you see, you have to travel 8 hours, 9 hours. And you are just within the center of Ghana. Please, let's be open now. Let's leverage on the opportunities that we have. Every place I've got challenges, but I think the opportunities are more than this. And today, I believe that I'm here to share this thing with you. I hope that the next time that I see you, may we rise as nurses beyond borders, as nurses beyond Achimota, making greater impact all over the places. Be on your feet, we say this and I sit down. Say, I am empowered to lead as a nurse. I am empowered to lead in my generation. I will not disappoint my profession. I will not disappoint my hospital. I will not disappoint my country. I will learn. I will build capacity. I will become a global figure. I will make impact. Tell somebody I will make impact. Tell the person I will make impact. Tell the person I'm going global. I'm going global. Treat me with care. For very soon. You will struggle. Touch with me. Treat me with care. Going somewhere. Going somewhere. Give somebody a high five. Tell the person I'm going somewhere. God bless you. Thank you so much. On Facebook, you can catch me, Jefferson Kwesi Agbutro, on Facebook, on TikTok, Jack Leadership and Management Consulting on TikTok, Jack Leadership. You will see me, Facebook, Jefferson Kwesi Agbutro. Let's get in touch, and I believe that we have a lot to do. Can we sing this one? It's my favorite song. I don't know why they are playing. Let's sing this song, and I'll sing it. It's my favorite song. Yeah, na ya sasini, ya bo de maya. Edumene wososo, seyeme yibiatwaso, yibiatwaso koto kraninya fese mekunya, eduyeme muhamaya sasimu asose. Omani seriyo, omani seriyo, eyese na ose, omafo brande. And the Lord bless you. Thank you, everybody.
Please take your time.
Okay.
What do we say to him?